Welcome to Advanced Nurses. We connect with nurses who inspire other nurses by sharing their experiences. And so we're able to bring that information to you. Hi, I am the educational consultant with Advanced Nurses at ACD4N, and today we have Anneleah Williams Bridges. She is the author of Bridging the Gap Between Coding and Clinical Documentation Improvement. And just to give some background about Anneleah, Anneleah Williams Bridges began her career in healthcare working from the third-party payer's perspective, gaining an in-depth understanding of reimbursement methodologies and regulations. She continued to advance her skill set and grow her clinical knowledge, including becoming a certified medical billing and coding specialist for hospitals and physicians. During the years, her knowledge of revenue cycle quality and compliance has earned her recognition in the industry as an educator of best practices, CDI, and coding compliance. Anneleah holds several credentials from the top leading organizations in the healthcare industry. She's a registered health information administrator, a HEMA certified coding specialist, a certified clinical documentation improvement specialist, and a rural health coding and billing specialist. She's also a licensed health insurance and managed care professional. So, Anneleah, if I've missed anything, would you mind just letting us know, first of all, where did you begin your journey? What led you into HIM?
Great question, and thank you for having me. I'm excited about this topic. What led me toward HIM and CDI and ultimately writing this professional manuscript was it started from my passion with having a positive impact for patient care. So let me back that up a little bit. When I started my career, I started as a medical coder, and one of the things that I was looking for was a way to have meaningful impact on the care that patients receive, but not being front and center. So I was a non-clinical professional, but I wanted to add value to the industry. And I found that through HIM and working as a medical coder and expanding my knowledge to CDI. And what most HIM professionals, I believe, they don't quite realize the amount of or the significance of what they bring in the background, even though they're not up front or in the front and center of clinical care. They really do help in facilitating continuity of care and the quality of care that that patient experiences.
Wow, thank you. And I think you're pretty on it when you say they don't really maybe fully understand their impact. Now, do you believe that that has something to do with just like the system not understanding the value, or do you believe that um, it's more so maybe just related to maybe the process as far as I'll say it this way. Oftentimes when it comes to like medical billing, sometimes because the work is very administrative and it's not like you said, they're not the
Mhm.
patient facing, sometimes they kind of get lost in the crowd, if you understand what I'm saying.
Right.
So
Yeah,
do you believe that that is a part of it?
I do. I believe because it's administrative and because they're not necessarily working patient facing, that sometimes they may not understand that they have the ability to affect that patient. And even so, they have the ability to serve to an extent as an advocate for that patient. And when I say an advocate for that patient, they're able to advocate for that patient's clinical truth. And that's what's important for HIM professionals to keep in mind, that when they're doing their work in the background, that it really is valuable, and they're, in a sense, they're advocating for the best care for that patient.
I couldn't agree with you more. I know for a lot of nurses, when they're interested in doing like non-traditional nursing roles, oftentimes it's, those same ideas that they have to kind of remind themselves, like, I'm still having a positive influence. I'm still having an impact in
Exactly.
the outcome of the patient's care. So definitely, and we know that especially when you talk about things like, for example, quality of care and capturing some of those risk factors that we can only really capture when we are monitoring that data very closely, and that's really, um, I guess you'd say central to the HIM professional's role. So.
Absolutely.
Um, so please, I want to find out more about the book. Like, how did you
Mhm.
approach the breakdown of the book? Because what I love about the book is it includes the clinical indicators along with the best practices for coding.
Mhm.
So, if you are even completely new to HIM, you're new to medical coding, you're new to CDI, you get to really put those pieces together. And, my audience is
Yeah.
primarily nurses, not exclusively, but primarily. And for some, the terminology is really familiar, but it's really putting it together where the
Exactly.
problem, I think, really lies with, as far as that learning curve. So yeah, so what made you kind of approach designing the book that way?
So I really wanted to help the two, um, help the coding professionals and the CDI professionals to speak the same language. Because right now, you'll see that CDI, they have their the clinical background, um, they're able to review the chart through a different lens than what coders are able to do. Coders are able to, although they're non-clinical, they're aware of the federal and state regulations, the coding guidelines that are pertaining to the codes that are being assigned. And that doesn't always translate to CDI, and CDI doesn't always translate to the official coding guidelines. So when I approached the book, I wanted to find a way to marry the two and allow them both to kind of speak the same language and understand both perspectives when they're reviewing a chart.
Wow. I mean, and I think that, again, as I mentioned prior, that is central to understanding both perspectives, especially for the nurse, because again, nurses play a role where they're because they're patient facing. Sometimes there's this idea that just like they are the key players, like the only players within the
Mhm.
healthcare system. And so therefore they lose sight of the contribution and the perspectives of other people who work just right next to them. I mean, you really
Right.
can't do healthcare with just nurses. The HIM team is right there. I can't
Right.
tell you how many places I've worked at where the HIM team, those professionals are the ones that's telling us kind of like what needs to be in our documentation, or what, how to
Mhm.
report things like vaccinations in the health record, or, things that we have to, whether it's for regulatory purposes or whether it's because of how this information is like feeding into like other data, collection tunnels, whatever, or channels. So, I think
Right.
it's you really can't get one without the other. But again, understanding those different perspectives is key. So I know I asked you this before. You said that there was not a play on words, as far as your name and the book title, but I thought it was really cute when I seen it, because I was like, "Oh, that's awesome." Because
Yes.
and I'll just be fully transparent. When I actually
Mhm.
purchased your book, because I purchased your book years ago, but when I purchased your book, I purchased your book because I was actually in the process of writing content, and I wanted a framework, and I wanted to really understand, like, okay, so what is the best way to approach this for a nurse? And again, finding your book and using your book, and I thought to myself, this is a great way to make that connection. And again, like, bridging the gap and making that connection for the nurse, so the nurse sees not only the documentation and the clinical piece of it, but they can also see, okay, this is how coding fits in. Because again, your book title suggests that there is a difference between the CDI and the coder, and you did explain
Absolutely.
some of that. But what do you think are some of the key differences between the CDI and the coder, and areas where you believe that there's still opportunity for more connection, or to make those languages more similar, because you were saying that the languages right now are kind of
Mhm.
like a little disparate. So what do you think?
Right.
Hmm.
So I believe that the industry has done a lot. They've made a lot of effort in bringing it more together, making it more cohesive, the CDI and coding language, so to speak. Some of the main differences that I see is that from a CDI perspective, the CDS will review the chart and they can see that they may have strong feelings and say, well, this is definitely an NSTEMI, or this is definitely septic shock. And, they may see those indicators and may even question, why didn't the coder code this,
Hmm.
But from a coding perspective, the coders, they may say, well, I didn't code that because the doctor didn't say it, or the doctor didn't document it, or there was, something that was coding guideline um, influenced, where they weren't able to capture that certain diagnosis because the guideline didn't support it, or the documentation in that sense. But I believe that we see a lot of conversation that needs to happen when we're faced with documentation integrity versus coding guidelines, and that's where the power of queries come in. And
Yes.
I
Hmm.
believe with any program, just having a robust program, it includes educating the coders as well as the CDIS on the use of compliant queries, query templates, and just ensuring that they're educated and well equipped to use those tools so that they can work together, opposed to being siloed and being siloed teams, siloed entities.
I would hope that anyone would refer to your book as a resource to help move that process along, because I know one thing I've seen as a pattern is sometimes with coders, if they don't have a clinical background, or if they have not worked for many years within a clinical space, sometimes
Mhm.
there's just, I don't know if you would like to say, a kind of intimidation to
Mhm.
confront doctors or question doctors about their documentation. And so therefore it's kind of left like what you said, well, this is what the guideline says, this is what the doctor documented, and I'm not going to ask that
Right.
doctor why she wrote what she wrote. I'm not going to ask them why you wrote what
Exactly.
you wrote. I'm just going to code it because the guidelines allows for me to code it this way.
And that's where the
Mhm.
CDIS comes in, right? And they say, well, we see X, Y, and Z indicators. Why aren't you picking this up? Or let's do a query and let's see what the provider has to say about this. So education is a great way to kind of merge the two teams.
Definitely. Well, I'll say this: when it comes to the CDI, the numbers show, okay, about 70% or so of CDI are nurses. And
Hmm.
I think that sometimes, with, again, your book would be a perfect resource for this, because this problem, where you have nurses who may not necessarily understand the coding guidelines. And so therefore, even if they do have that, familiarity or comfortability with the provider, they may not understand the importance of the guidelines, especially if we are practicing to use systems like, namely, like, encoders and things like that, that makes it a little
Hmm.
easier for us, but then we skip out on kind of understanding the importance of using a coding manual, for example. So there,
Right.
again, there needs to be appreciation for on both sides. So
I agree.
I do have one last question for you.
Hmm.
The question I have for you is, What is your thoughts on like offshoring? Like as far as offshoring CDI or offshoring coding? So I know that a lot of companies explore that as a kind of like money saving strategy. But what is your overall thoughts on that?
That's a really good question and controversial.
Sorry. Okay.
um,
So we won't have to get
there's
too political here.
right. No, just from what I've seen, I've worked with multiple facilities in my consulting years, and there's two arguments to that, or two sides, or two thoughts um, that I've heard and that the executive teams have expressed. One being that when you offshore, you're potentially as you're potentially creating a risk for the facility where you send data and you have this open sharing, and once it's outside of the US, there's not much you can do once that data is breached, because now you have another country involved, or that may not have the same security elements as the US. So that is a concern that I've heard from hospital leadership teams. On the other hand, facilities that utilize a secure network or VPN, which most do at this time in the industry, I would think, and from what I've heard too, that using that secure VPN, that is one of the most secure ways to keep the patient records confidential and keep
Mhm.
PHI secure through that VPN. So the risk, I think it really depends upon the facility, their security, and what safeguards they have in place to ensure that there's no breaches. And should a breach occur, what action plans do they have to mitigate quickly if something like that was to occur? And I think based upon the answers to those questions, and each facility may answer those questions differently, but based upon the answers, I think that would help that facility determine if it's a good idea for them or not.
Awesome. Well, I do want to thank you for your time. I am, again, I'm going to be screaming your book out to the rooftops for all my nurses.
Thank
One of the
you.
things, again, I'm big on promoting nurses to, explore non-traditional nursing roles. A lot of nurses, they get into this
Mhm.
mindset that they're like, you know, burned out, or maybe they're confused about what the next step should look like. Everybody doesn't want to be a nurse
Right.
practitioner. Everybody doesn't want to be a nurse anesthetist. For some
Hmm.
people, it's really about not even knowing what they want to do next. And I'm big on,
Yeah,
you know, HIM is a great option,
it
and
is. It
mhm,
really is.
it is. It is. It truly is. And you know what I'm finding now too? I'm finding that there is, because of how HIM has evolved over time, there's so much more
Mhm.
opportunities to for like high earning, salaries, high earning roles and positions. So for me, I'm
Mhm.
also big on, you don't have to feel like going in HIM is you stepping down, because honestly, the advancements in HIM, from what I'm observing, they seem to be
Yeah.
surpassing a lot of what we see, as your frontline nursing work, because of the fact
Mhm.
that there has been an emphasis on, not like you just said, data security, data management, data collection, whether it's from digital devices or from, even the communication that we get from the encounters with patients. So it's kind of my question I always ask nurses is, aren't you curious what happens to that information after you collect it? So it's kind of like HIM is kind of the answer to that question. Like, this is what happens to it.
Exactly. I would just add, for the nurses who are looking to transition to HIM, some things that they should consider is
Sure.
just looking at the resources that are out there. HEMA offers resources, AAPC, as well as ACTIS. They offer valuable resources to help um, clinical transfer over to, the HIM roles. And I would really recommend that they begin to expand their knowledge by looking at these resources and looking at coding guidelines, maybe even pursuing a coding certification that would help expand their skill set in the coding and HIM realm. And that'll help them be successful in some of these roles. There is a large demand for nurses in this field.
Well, you said it, not me. So just in case anyone thinks that this is something I'm coming up with, nope, you heard it from the subject matter expert and author herself. There's a large demand for nurses, and for me, I look at it as an opportunity for you to use all your clinical knowledge and direct it into a space where you'll be doing a lot more critical thinking. You'll be using your head, but you won't have to worry so much about that physical burnout that a lot of nurses are experiencing now. And it's understandable because healthcare has become more complex, but at the same time, healthcare is also evolving in a way that there's a lot more solutions. So we don't have to be bogged down with problems. We have solutions. And I want to thank you again for your book. I will be including a link to your book in the description of this video. And again, that is Bridging the Gap Between Coding and Clinical Documentation Improvement. Thank you, Ms. Anneleah Williams-Bridges, for your time, and I wish you the best.
Thank you.
We want to hear from you. Schedule a free consultation or send us an email at advancednurses@acd4n.com or visit our websites www.advancednurses.info or www.acd4n.com.